Social anxiety disorder, SAD, symptoms. Introduction. Definition of social anxiety disorder, SAD. Social anxiety disorder, SAD, also known as social phobia, is a mental health condition characterized by an intense, persistent fear of being watched and judged by others. This fear can be so severe that it interferes with daily activities, such as work, school, and personal relationships. Individuals with SAD often recognize that their fear is excessive or unreasonable, yet they feel powerless to overcome it. Prevalence and demographic information. SAD is one of the most common anxiety disorders, affecting millions of people worldwide. According to the National Institute of Mental Health, NIM, approximately 7.1% of U.S. adults experienced SAD in the past year. The condition typically begins in childhood or adolescence, with a median age of onset at 13 years. Women are slightly more likely to be affected than men. Symptoms of social anxiety disorder. Emotional symptoms. Intense fear of social situations. One of the hallmark symptoms of SAD is an overwhelming fear of social or performance situations in which an individual might be scrutinized by others. This fear is often out of proportion to the actual threat posed by the situation. For example, a person with SAD may dread giving a speech, attending a party, or even eating in public. Fear of being judged or embarrassed. Individuals with SAD are extremely self-conscious and worried about being negatively evaluated by others. They fear that their actions or appearance will lead to embarrassment or humiliation. This fear of judgment can be so debilitating that it prevents them from participating in social activities they once enjoyed. Anticipatory anxiety. The anticipation of a feared social situation can trigger significant anxiety long before the event occurs. This anticipatory anxiety can lead to a cycle of worry and avoidance, making it difficult for individuals with SAD to engage in everyday activities. Physical symptoms. Sweating. Excessive sweating is a common physical symptom of SAD. It often occurs in situations where the person feels anxious or stressed, such as during a public speaking engagement or a job interview. The sweating can be so severe that it becomes noticeable to others, which can exacerbate the individual's fear of being judged. Trembling or shaking. Trembling or shaking is another physical manifestation of social anxiety. This symptom can be particularly distressing in situations where steadiness is required, such as holding a drink or shaking hands. The fear of visibly shaking can further intensify the individual's anxiety. Blushing. Blushing is a frequent and distressing symptom for individuals with SAD. The sudden reddening of the face can occur in response to even minor social interactions, leading to a heightened sense of self-consciousness and embarrassment. Rapid heartbeat. A rapid or pounding heartbeat is a common physical response to anxiety. In social situations, individuals with SAD may experience palpitations, which can make them feel as though they are on the verge of a panic attack. Shortness of breath. Shortness of breath or hyperventilation can occur during episodes of intense social anxiety. This symptom can make it difficult for individuals to speak or interact comfortably in social settings. Behavioral symptoms. Avoidance of social situations. Avoidance is a key behavioral symptom of SAD. Individuals may go to great lengths to avoid social interactions that trigger their anxiety. This can include skipping classes, calling in sick to work, or declining social invitations. Difficulty making eye contact. Many people with SAD find it challenging to make eye contact with others. They may look away or down during conversations, which can be perceived as a lack of confidence or interest. Social isolation. The combination of avoidance and difficulty interacting with others often leads to social isolation. Individuals with SAD may withdraw from social activities, leading to loneliness and a reduced quality of life. Cognitive symptoms. Negative self-talk. Negative self-talk is a pervasive cognitive symptom of SAD. Individuals with the disorder often have an internal dialogue that is critical and self-deprecating. They may believe that they are inadequate, unlikable, or destined to fail in social situations. Rumination over past social interactions. People with SAD tend to ruminate excessively over past social interactions, replaying conversations in their minds and focusing on perceived mistakes or awkward moments. This rumination can lead to a persistent sense of shame and self-doubt. Catastrophizing potential social interactions. Catastrophizing involves imagining the worst possible outcome in a given situation. Individuals with SAD often predict that social interactions will be disastrous, leading to extreme anxiety and avoidance behaviors. Causes and risk factors. Genetic factors. Research suggests that genetics play a significant role in the development of SAD. Individuals with a family history of anxiety disorders are more likely to develop SAD themselves. Twin studies have also shown a higher concordance rate for SAD among identical twins compared to fraternal twins. Environmental influences. Environmental factors, such as childhood experiences and parenting styles, can contribute to the development of SAD. Negative experiences, such as bullying, rejection, or humiliation, can increase the risk of developing social anxiety. Overprotective or critical parenting may also play a role. Brain structure and function. Neuroimaging studies have identified differences in brain structure and function in individuals with SAD. The amygdala, a region of the brain involved in processing fear and emotions, tends to be overactive in people with social anxiety. Additionally, imbalances in neurotransmitters such as serotonin and dopamine have been implicated in the disorder. Diagnosis. Criteria for diagnosis, DSM-5. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, outlines specific criteria for diagnosing SAD. These criteria include a marked fear or anxiety about one or more social situations, avoidance behaviors, and significant impairment in daily functioning. The fear or anxiety must be persistent, typically lasting for 6 months or more. Differentiating SAD from normal shyness. It is important to distinguish SAD from normal shyness. While shyness is a common personality trait, it does not typically interfere with daily life or cause significant distress. In contrast, SAD involves an intense fear of social situations that impairs an individual's ability to function. Importance of professional assessment. A thorough assessment by a mental health professional is essential for an accurate diagnosis of SAD. This may involve a clinical interview, self-report questionnaires, and observation of the individual's behavior in social situations. Impact on daily life. Effects on work or school performance. SAD can significantly impact an individual's performance at work or school. Fear of speaking up in meetings, giving presentations, or interacting with colleagues can hinder career advancement and academic success. In severe cases, individuals may avoid certain jobs or educational opportunities altogether. Challenges in personal relationships. The fear of social interactions can make it difficult for individuals with SAD to form and maintain personal relationships. They may struggle to initiate conversations, make friends, or engage in romantic relationships. This can lead to feelings of loneliness and isolation. Impact on overall quality of life. The combination of emotional, physical, behavioral, and cognitive symptoms can severely affect an individual's quality of life. SAD can lead to missed opportunities, reduced self-esteem, and a diminished sense of well-being. Co-occurring conditions. Depression. Depression is a common co-occurring condition with SAD. The chronic stress and isolation associated with social anxiety can contribute to the development of depressive symptoms such as persistent sadness, loss of interest in activities, and fatigue. Other anxiety disorders. Individuals with SAD are at an increased risk of developing other anxiety disorders such as generalized anxiety disorder, GAD, panic disorder, and specific phobias. The presence of multiple anxiety disorders can complicate the diagnosis and treatment process. Substance abuse. Some individuals with SAD may turn to alcohol or drugs as a way to cope with their anxiety. This can lead to substance abuse or dependence, further exacerbating the individual's mental health challenges. Treatment and management. Therapy options. Cognitive behavioral therapy, CBT. CBT is a widely used and effective treatment for SAD. It involves identifying and challenging negative thought patterns and behaviors related to social anxiety. Through exposure exercises and cognitive restructuring, individuals learn to manage their anxiety and develop healthier coping strategies. Exposure therapy. Exposure therapy is a type of CBT that involves gradually confronting feared social situations in a controlled and systematic manner. This helps individuals build confidence and reduce their anxiety over time. Group therapy. Group therapy provides a supportive environment where individuals with SAD can practice social skills and share their experiences. It can be particularly beneficial for reducing feelings of isolation and building a sense of community. Medication. Selective serotonin reuptake inhibitors, SSRIs. SSRIs, such as sertraline, Zoloft, and fluoxetine, Prozac, are commonly prescribed to treat SAD. These medications work by increasing the levels of serotonin in the brain, which can help reduce anxiety symptoms. Benzodiazepines. Benzodiazepines, such as clonazepam, Klonopin, and alprazolam, Xanax, may be prescribed for short-term relief of severe anxiety symptoms. However, they are generally used with caution due to the risk of dependence and side effects. Beta blockers. Beta blockers, such as propranolol, Inderol, are sometimes used to manage the physical symptoms of social anxiety, such as rapid heartbeat and trembling. They are particularly useful for situational anxiety, such as performance anxiety. Self-help strategies. Mindfulness and relaxation techniques. Mindfulness meditation and relaxation techniques, such as deep breathing and progressive muscle relaxation, can help individuals manage their anxiety and stay grounded in the present moment. Lifestyle changes. Adopting a healthy lifestyle can have a positive impact on social anxiety. Regular exercise, a balanced diet, adequate sleep, and avoiding caffeine and alcohol can help reduce anxiety symptoms. Support groups. Joining a support group, either in person or online, can provide individuals with a sense of community and understanding. Sharing experiences and learning from others can be empowering and reduce feelings of isolation. Living with social anxiety disorder. Personal stories and case studies. Hearing about the experiences of others with SAD can provide valuable insights and inspiration. Personal stories and case studies highlight the challenges and triumphs of living with social anxiety. Coping strategies. Developing effective coping strategies is essential for managing SAD. This may include setting small, achievable goals, practicing self-compassion, and seeking professional help when needed. Tips for friends and family. Friends and family members can play a crucial role in supporting individuals with SAD. Educating themselves about the disorder, offering encouragement, and being patient can make a significant difference. Current research and future directions. Recent studies on SAD. Ongoing research continues to shed light on the causes and treatment of SAD. Recent studies have explored topics such as the genetic basis of the disorder, the effectiveness of new therapies, and the role of technology in treatment. Potential new treatments. Emerging treatments for SAD include novel medications, virtual reality exposure therapy, and advancements in psychotherapy techniques. Continued research and innovation hold promise for improving the lives of individuals with social anxiety. Conclusion. Summary of key points. Social anxiety disorder is a prevalent and debilitating condition characterized by intense fear and avoidance of social situations. The symptoms of SAD can have a profound impact on an individual's emotional, physical, and cognitive well-being. Understanding the causes, recognizing the symptoms, and seeking appropriate treatment are crucial steps in managing the disorder. Encouragement for seeking help. If you or someone you know is struggling with social anxiety, it is important to seek help from a mental health professional. With the right support and treatment, individuals with SAD can lead fulfilling and meaningful lives. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.